Welcome to today's press briefing. With us today are two doctors, Dr. Chong-Shuk Kwan, Head of Communicable Disease Branch, CHP, and Dr. Larry Lee, Chief Manager, HA. Two doctors will bring us up to date on the COVID situation and HA situation. Dr. Chong, please. Yesterday, we registered 4,090 local cases. 1,522 are PCR positives. 2,568 are RAT verified cases, and 180 imported cases, 159 PCR positives, and 21 RAT. The HA reported 6 diseased cases in the fifth wave. The total number of fatalities stands at 9,241. I defer to the HA. We have 1,257 patients hospitalized, 177 are newly infected patients. For those in isolation facilities, 395 are in isolation wards, 23 in second-tier ward, 422 are at Atlanta Hospital, ICC, 148 are newly infected patients. We have reported 8 in critical condition, of whom 6 had 2 shots, 1 had 1 shot, 12 are in critical condition. For those hospitalized, 18 are in critical condition, 29 in serious condition. For 2 of the critical patients are in ICUs for treatment. We have reported 6 patients who passed away yesterday. One 78-year-old male who passed away the day before yesterday. 1 male and 3 female passed away yesterday, 72 to 97 in ages. They were not from care homes. 1 had 1 shot, 2 had 2 shots, and 1 had no vaccination record. 72-year-old female had 2 shots. She had hypertension, diabetes, heart condition, and heart failure. On 21st of July, she was admitted to POH, A&E, and she wouldn't wake up at home, and she was suffering from a cardiac shock. And her family members tested RAT positive, and she was a close contact when she was in the A&E. She tested RAT positive. Upon admission screening, she tested PCR positive and CT value 13.6. In the A&E, we continued with the resuscitation. She didn't respond to the resuscitation, and at 6 a.m. she passed away. The second 89-year-old male with 2 shots, also a chronic patient with renal failure and neurodegeneration, and his son tested RAT positive. On July 7th, he was admitted to Tuen Mun Hospital from the PCR test tested positive with CT value around 14. We prescribed some special medication to him, and he stabilized. On July 13, he was transferred to North Lantau ICC. The infection was serious, and we prescribed antibiotics, and the condition worsened on 18th. And on July 22nd, he passed away. The third patient, 70-year-old male with 1 shot. He had some hypertension, diabetes, and he was admitted to Chang Chao St. John's Hospital. He had a fever, shortness of breath. He tested RAT positive, and he also tested PCR positive. CT value was about 20, and he was sent to PYNEH, and his cardiac enzyme was high and blood pressure dropped, and we treated it as myocardial infarction. His condition worsened on July 20th. Nighttime, around about 10 p.m., he passed away. The fourth patient, 78-year-old female, had no vaccination record. She suffered from renal failure and stroke On July 6, she tested RAT positive, and she was admitted to PYNEH A&E for fever and shortness of breath, and she suffered from ground glass opacity in her lungs, and she tested positive, and she was undergoing treatment with steroid and anticoagulant. On July 14th, she was discharged to continue with the home quarantine. Her daughter was also positive, and she looked after her. On July 15, she suffered from discomfort with some shortness of breath, and she was readmitted to the A&E. Thereafter, her condition worsened with renal function worsening. On July 21st, she passed away. 95-year-old female with 3 shots. She suffered from cardiac condition, hypertension, and asthma. On July 13th p.m., she was admitted to PWH A&E for shortness of breath. She tested RAT and PCR positive. She had opacity in her lung, and she was prescribed remdesivir and steroid in hospital, but her blood pressure and blood oxygen worsened, and she passed away. 97-year-old female. She had hypertension, diabetes, and neurodegeneration. On July 21st, she was admitted to PWH A&E, and she passed out at home. She had fever for 4 days. When she was admitted to hospital, she had no heartbeat, and she was resuscitated, but subsequently she passed away on July 21st. I hand you back to Dr. Chuang. For the 188 imported cases, 78 were picked up from the airport, and 97 were picked up from the quarantine hotels. 5 left the quarantine hotels already. For the care homes, there are 3 care homes that reported some cases of residents. Donggang Care Home in Yaoqingmong District, 1 resident tested positive. 5 other residents had to be subject to quarantine. Guanyik Sanging Care Home in Chunmun, 1 resident tested positive, and the other 6 co-residents had to be quarantined. And Tingwogui Elderly Home, 1 resident tested positive, and 4 had to be quarantined. For schools, there are 340 schools that reported a total of 445 cases, 365 students, and 77 staff members. They are from 76 KG, CCC, 145 primary school, 107 secondary school, and 12 special schools. Over the past 7 days, 194 schools reported 2 or more COVID-positive cases. Today, we advised 8 schools and KGs be suspended. International English Kindergarten, that's in Kowloon City. Essex Road, Kowloon City. And Lady and nursery, PM class, 13 students. There is 1 teacher and 1 student who tested COVID positive, and this class has to be suspended for a week. In Causeway Bay, Hennessy Road Primary Government School, 2L class, and the 3 students are tested positive, suspended for 1 week. Polangkok Losi Sun Tok School. This is a special school with 5 students, and it's hard for them to put on the face mask. There's 1 student who tested COVID positive, and the other students had to be suspended for a week. Baptist Hong Kong Rotary KG K3 Co-Oi class. There are 2 students who tested positive.
Buddhist Chi King, class 5C, there are 3 students confirmed positive. The class needs to suspend class for 1 week. And SKH kindergarten and primary, and also the Buddhist N3B class will need to be suspended for 1 week with over 3 students confirmed. And in Kaiyang Primary, there are 3 students in 1A confirmed. And there are over 148 patients which have been released. 148 have recovered, 135 released, and there are 3 new admissions, and there are 25,489 staff members who have recovered, and 24,925 have already returned to their work positions. And the Kowloon Hospital, there is a tracing of one of the patients, male patients, and with the tracing of close contacts, there are staff, 3 members of staff which need to be quarantined. And there is another case of another ward. There are another 2 patients which are confirmed positive, and they have been isolated for treatment in another hospital, and their situation is stable. And there are 8 other patients and 1 staff member who have been labeled as close contact, and the relevant wards have been cleansed. And there is a 91-year-old patient on the 18th of July in Tuen Mun Hospital confirmed positive, and on tracing there are 3 patients between the age of 72 and 86 years of age, and 4 staff members are close contacts, and their situation is stable, but all visitations have been stopped and thorough cleansing had been held, and also tracing of close contacts and relevant cases are underway. And in terms of the development of the COVID situation overall, because the patients in hospital is over 1,200, and today it is over 170 patients, new patients in the hospital. So we have come into the second phase of public hospital operation, because it has affected the public hospital's operation, even though there is preparation of beds and wards for COVID cases, but it is inevitable that there will be non-emergency cases which will have to suffer because of this pressure from COVID. So please protect yourself and the people around you, and we want to lower the serious cases and any diseases as much as possible. So this is the Q&A time. On the left, the gentleman over there. Doctors, TVB, greetings. First of all, about the isolation at home arrangement. BA.4, PA.5, BA.2.12.1 do not need to be sent to the centers for isolation and quarantine. I would like to know about possible clusters forming in the buildings that they reside. And if there should be these variant strains, will there be more supervision and monitoring? For example, the sewer monitoring or PCR testing, etc., so as to avoid spreading in the buildings. And secondly, about the wristbands, electronic wristbands, that's been a practice for some time. I would like to know, on average, how many days after reporting the cases would people or confirmed cases be able to receive these wristbands? Now, 3 days seems to be the average, but that seems to be halfway to 7 days. That may be too late. Can we compress the distribution of wristbands time, let's say, to 1 day? If 1 day is ideal, then the question is 1 day possible? Yes, I know that the government will be stepping up with testing and in the high-risk areas, including certain buildings. As for electronic wristband, I'm not very familiar with the situation. All I know is that we will be providing to the relevant unit a few times a day, and I know that the unit dispatches teams to the relevant cases to distribute the wristbands on a timely basis. Hello, Now TV. Concerning the Cathay cluster, it is said that there was a gathering in Chunwan that was held, but that has not been confirmed by Cathay Pacific. How many confirmed cases in the cluster? Where was this held? It is a retirement party, so was there dancing? Was there singing in the party? And also for the confirmed cases, did they come into contact with any new arrivals in Hong Kong or crew members? And also, would these confirmed persons come into contact with passengers? There are about 4,000 local cases on a daily basis now, and we will not be providing specific information on clusters or individual persons or clusters. Cable TV, a question for you. The 97-year-old woman who had died during the 4 days before her decease, were there RAT conducted? Now, there are more cases of old people dying in their homes, and they were discovered to be deceased. But is it possible that they should step up with the RAT testing at home? Would the cases in Hong Kong exceed 10,000 daily? Do you think it is possible? Should we make the measures for COVID prevention stricter in Hong Kong given the situation? And there is Dr. Leung Zi-Tiu. He mentioned about this kind of trend and increase in the COVID cases. And also, there are concerns among the old age homes and the care homes about the situation and the number of cases in the homes. Will you be supporting them? Now, as for the 97-year-old woman who had died, she had conducted no RAT tests at home. As for those who have not received vaccination and are of high risk, they should go for at least 3 shots. And for some of them, they should go for the 4th shot of vaccination so as to avoid serious or morbidity. And for those who are high risk or are of old age, where they are not feeling well, the friends and family members should take special care to do RAT for them, and these family members themselves should also take RAT so as to take better care of these high-risk persons in the house. And we do see the cases increasing locally, and as for when it will peak, the number of cases, and when it will come back down, that is difficult to foretell. But of course, we do not want the number of cases to increase too rapidly, or because it would affect the medical services. For positive cases and high-risk premises such as old age care homes, we would want to prevent any outbreaks in these areas. These are high-risk areas. And for other citizens of Hong Kong, we would want them to comply with the COVID prevention measures, and if they need to be quarantined, that they do comply with quarantine measures.
Doctors, Mingpao Daily. Dr. Lee, you mentioned 6 deceased cases. Did they all die of COVID? And also the deployment of hospital beds for the second phase, how many staff members will have to be redeployed, and are you going to be reopening the AWE? Now this is for HA. The staff members will have to observe the isolation order, and the staff members will have to take sick leave for the RTD. Would they have to be taking no-pay leave if they run out of leave? For the 6 deceased patients, I may not be getting to grips with whether they are related to COVID. The 97-year-old and 76-year-old, they passed out at home and were sent to the A&E. We may not be able to pass any comments there. For the remaining 3, from the X-ray results, they suffer from pneumonia. They came down with COVID, and CT value was low, and probably they are related to COVID. We mentioned the second stage. Basically, we adopt the tiered treatment system for hospitals, for instance. When we enter the second stage, the hospital beds, we can increase from 1,200 to 2,500 to cater for the pandemic situation at the North Lantau ICC, as that there will be staff members deployment to open the wards. There are 8 wards there already. For AWE, we will be monitoring the situation closely, and where necessary, we do have the plan and mechanism to deploy manpower to reopen the AWE. The key thing is for those patients who are isolating at home, we hope that they will be taking part in the teleconsultation via hotline. When they're done with the consultation, there will be medicine that will be delivered to them. Now, we will continue with the designated clinics as well. Speaker not coming through. Basic and non-emergency service. Next, penultimate row. Orange news. 2 questions, if I may, about the deceased cases. There is an 78-year-old female. On July 14, she was discharged. What was her condition upon discharge, or what was the CT value when she was readmitted to hospital? Why did her condition worsen so quickly? And what about the utilization of designated clinics? Do you see more people seeking help at the designated clinics? Do you see the merit of increasing the number of designated clinics? The 78-year-old female, basically, she suffered from renal failure. Upon admission, she was given treatment. Her condition stabilized. Her CT value upon admission was 17.9, and she was given treatment. She had rapid test. Now, she was living at home, and we discharged her for several reasons. Now, her daughter has been infected, and she would like to look after her mother at home, and she didn't need an oxygen treatment. When she was admitted, she suffered from shortness of breath, and the vital signs have become stable. And she was readmitted for some discomfort. Now, for her conditions, basically, she was suffering from renal failure, and there could be fluctuations in the condition. And after readmission, very quickly, the renal failure deteriorated rapidly, and she passed away. Your second question, right? Designated clinics. We don't have any data now. Perhaps we can supplement later. Next, please. Last row, a lady there at the back.
Okay, So about the affected non-urgent services at public hospitals, specifically what services have to be suspended. And also, people now have to take PCR tests before visiting elderly homes, but some who always visit the care homes are also elderly people, and they said it's difficult for them to make online bookings and take the tests at community centers. So is it possible for the government to maybe send people to care homes to help take the test for the visitors before they enter, or are there any other ways to make the testing easier for these visitors? Thank you.
Okay. I think for the HA services, I would like to stress on 2 points. So the service adjustment will be mainly on the non-emergency service, namely the elective surgery. But however, another point I like to stress on that is phase 2 is not a discrete phase, which is a continuum. So we just mentioned that we enter the phase 2, but we still try to keep our service as much as possible.
According to the press release issued by the Social Welfare Department, I think the visitors can go to the mobile testing center or the community testing center to get a free test, and saying that is for visiting the residential care homes. Then they can get a test as soon as possible.
Next, let's make it the last question. A lady over there, please. Economic Times. There are more and more cases. Have you changed the definition? Now, for those who are dining with the infected people, they will be regarded as close contacts. Now, in the declaration platform, there is no way you can declare who you had dined with. Now, you said that for clusters involving a small number of people, you will not make the announcement. Do you have any particular numbers and the threshold when you make an announcement? Now, there is a 97-year-old female. She had fever for 4 days, and she didn't seek medical consultation, and she passed away. How did you become aware that she had fever for 4 days? Why didn't she seek medical consultation? Did the HA liaise with the private sector to triage and refer some of the patients to the private sector, where the daily caseload is pretty high, standing at about 4,000. So the quarantine people are household contacts. Now, for schools and care homes, we will deal with them separately. For other clusters like bars and restaurants, if we spot a higher number of post-COVID positive cases, then we would activate an investigation and start the compulsory testing for private gatherings or household clusters. If they do not affect the members of the public, we probably would not announce them. For a 97-year-old female, she had fever for 4 days, and that's the information provided by the family members. Now, we made the announcement on the basis of the A&E record. The PPP, public-private partnership, this is in existence. In terms of hospital beds, at the beginning of the 5th wave, we did liaise with the private hospitals to utilize the low-charge beds in the private sector. In the PPP, in different disciplines, we do have cooperation. We do make adjustment as COVID evolves. And like hemodialysis patients, if they experience difficulties because of the pandemic, we can make adjustment in the PPP. And we're still continuing with this. That brings us to the end of the press conference. Thank you all very much.